Mental illness can affect anyone, regardless of age, race, or gender. It is important to be aware of the signs and symptoms of mental illness that can help lead to a proper diagnosis and treatment. This video will provide an overview of 10 signs of mental illness that may indicate the need to seek professional help. It is important to observe any changes in behavior, thought patterns, and mood over time, as these can all be signs of an underlying mental health issue. Sign number 1. Stomach pain. Stomach pain is often a symptom of physical conditions like indigestion or acid reflux. However, sudden stomach aches during times of anxiety could indicate poor mental health. The connection between the gut and brain is well established, and when a person experiences anxiety, their brain signals the digestive tract to slow down. This leads to symptoms like stomach cramps, pain, and bloating. The feeling of having a knot in the stomach during anxious moments is a common expression and has a physiological basis. So, if you're experiencing recurrent stomach pain, it may be worth considering its connection to your mental well-being. Sign number 2. Chronic pain. Chronic pain is a long-lasting form of physical pain that can impact your mental health. While it is often caused by physical injuries, studies have shown that chronic pain can also be a symptom of depression, anxiety, and post-traumatic stress disorder, PTSD. When you experience chronic pain, it can be difficult to manage day-to-day activities, and can lead to feelings of hopelessness and helplessness. This, in turn, can make the pain worse and create a vicious cycle that affects both your physical and mental health. It's important to seek help if you are experiencing chronic pain, as it can be treated with a combination of therapy, medication, and lifestyle changes. Sign number 3. Serious lack of motivation. Experiencing a lack of motivation and energy can be a sign of depression. If you're feeling like you just can't find the energy or drive to do the things you once loved, it could be an indication of a deeper problem. This can manifest in a variety of ways, such as not feeling excited about hobbies or activities you used to enjoy, or even feeling physically drained when you try to engage in them. It's important to understand that this lack of motivation can impact all aspects of your life, including work and relationships. If you're feeling unmotivated, it's important to seek help from a mental health professional. With the right support, you can regain your energy and enthusiasm for life. Sign number 4. Manic periods. Manic periods are periods of extreme highs and intense energy levels. While they may seem like a good thing at first, they can quickly become dangerous and impact your daily life in a negative way. People experiencing manic periods often feel like they have a limitless amount of energy and can tackle anything that comes their way, but this can lead to reckless behavior, impulsiveness, and a decreased ability to make rational decisions. This type of behavior is a symptom of bipolar disorder, and it's important to seek professional help if you are experiencing manic periods. A mental health professional can help you manage these episodes and create a treatment plan to improve your overall mental health. Sign number 5. Paranoia. Paranoia is a state of intense fear and anxiety where an individual believes that they are being threatened or persecuted by someone or something. It's often a symptom of mental health disorders such as schizophrenia, bipolar disorder, or depression. Paranoia can also be triggered by stress and trauma, and it can have a profound impact on a person's life. People with paranoia may have a distorted perception of reality and can become fearful, suspicious, and mistrustful of others. In some cases, paranoia can lead to social isolation and a decline in a person's overall well-being. If you are experiencing paranoia, it's important to seek help from a mental health professional as soon as possible to get the right diagnosis and treatment. Sign number 6. Compulsions and fear-based behavior. Compulsive behavior, such as repetitive hand-washing, counting, or checking, can be a sign of mental health issues such as obsessive-compulsive disorder, OCD. Additionally, fear-based behavior, such as avoiding certain situations or people, can also be an indication of anxiety disorders. These behaviors can interfere with daily life and activities and can also become intense and time-consuming. Studies have shown that anxiety and stress can trigger compulsive behavior and that people who experience paranoia and phobias may also engage in compulsive behaviors. If you notice that your compulsive behaviors or fear-based behaviors are impacting your daily life, it may be time to seek help from a mental health professional. Sign number 7. Serious anhedonia. Anhedonia is a condition where you're unable to feel pleasure from things that would normally bring joy. It's a common symptom of depression and other mental health disorders. People with anhedonia may find it difficult to enjoy activities they once loved, feel a lack of motivation, or experience a decreased interest in socializing. It's important to note that feeling sad or down sometimes is a normal part of life, but if you're consistently unable to find joy in things that once brought happiness, it's a sign of a more serious issue. If you're struggling with anhedonia, seeking support from a mental health professional is key to getting back to feeling like yourself again. Sign number 8. Weight changes. Weight fluctuations can be a common occurrence for many people, but if you're experiencing drastic and sudden changes in weight without making any dietary changes, it could be a sign of a mental health disorder. Weight changes are a symptom of depression, anxiety, and other mood disorders. When someone is feeling down, they may lose their appetite and experience weight loss. On the other hand, when someone is feeling anxious or stressed, they may overeat and gain weight. It's important to pay attention to your weight and any changes that may be occurring, and speak with a mental health professional if you suspect a potential issue. Sign number 9. Sleeping too much or not enough. Sleep is one of the most important aspects of our overall health, and getting the right amount of restful sleep each night is crucial to maintaining a healthy mind and body. However, changes in our sleep patterns can often indicate problems with our mental health. People who experience excessive sleepiness, insomnia, or even hypersomnia, where they sleep for prolonged periods of time, may be struggling with a mental health issue such as depression, anxiety, or bipolar disorder. On the other hand, those who experience chronic insomnia may be feeling overwhelmed and unable to relax, leading to a constant state of anxiety and stress. In any case, if you're struggling with your sleep, it's important to reach out to a healthcare professional for support and guidance. Treating underlying mental health issues can help improve your sleep patterns and overall well-being. Sign number 10. Self-punishing thoughts. Self-punishing thoughts can be a serious sign of poor mental health. People who experience these thoughts often feel guilty, worthless, and hopeless. They may blame themselves for things they have no control over, and they may have negative thoughts about themselves that they can't shake. This can lead to a vicious cycle of self-doubt and self-criticism that can be difficult to break. It's important to recognize these thoughts as a symptom of a larger issue and to seek help from a mental health professional if they become persistent and disruptive to daily life. With proper treatment, it's possible to overcome these negative thought patterns and live a happy and fulfilling life. In conclusion, while these signs may indicate a mental health disorder, it's important to remember that everyone experiences them differently. If you have concerns about your mental health, it's always best to reach out to a doctor or mental health professional for an evaluation.